Hello, and thank you for joining us for this COVID-19 training. I am Christine Welsh, Director of Human Resources, and I'm with Marguerite Gustafson, our registered nurse for Hatboro-Horsham School District. We put this training together for you because we wanted to have a place where most of this information resides in other places, but we wanted to have one concise place for everyone to be able to reference a lot of important information. The information that we will be talking about here can also be found in our health and safety plan, which is on our COVID-19 related page right now. We are sitting in a room where we are socially distant and are going to be passing this laptop back and forth. But I want you to know that all the precautions we're talking about today have also been in place with ourselves today. Just wanted to review real quick what we will be talking about in this training. We have the Safe Schools training that will talk about behaviors to prevent the spread of COVID, face coverings or face masks and things related, the signs and symptoms, isolation, quarantine, when to stay home, when to come to work, returning to the environment post-COVID-19, the sign-in procedures, sign-out procedures, student attendance, monitoring and observing staff and students, high-risk students and staff, guidelines for sending a student to the nurse, and infection control measures for protective equipment, personal protective equipment. So all employees and staff are required to complete the COVID-19 courses in Safe Schools. That has been assigned, and there are updates that come periodically. You know, this is a changing environment, so I would just ask for your cooperation. Should you have any questions or concerns about a training that was completed and is not showing as completed, you can reach out to Barbara Kessler in my office or myself, Christine Welsh, and we will look at the back end of that. But these courses are available to you for general information about COVID-19 and the spread. It includes information on symptoms and measures to slow the spread, which we are going to also review today. So some of the measures and or behaviors to prevent the spread. It's important to reduce the transmission, obviously, of COVID-19. And there are individual and also environmental measures that can be put in place to detect and to isolate cases. There's contact tracing. There is the idea of quarantine. We all have heard social and physical distancing measures, including what to do in larger crowds, what to do if you've had travel, especially to states that may be identified as otherwise high case content areas. And then, of course, we are all looking towards the day where a vaccine or some kind of treatment would be put in place. While these vaccines are not yet available for COVID-19, there's other public health and safety measures that play an essential role in reducing the number of infections, and of course, that results in saving lives. The biggest thing being social distancing, staying 6 feet apart from other individuals while in all of the school buildings, and sometimes in other locations such as playgrounds and common areas will be essential and will be enforced. The idea of wearing a face mask at all times. We are under a governor's orders and we are complying with that 100%. We will talk today about those that have special circumstances which may need to create alternatives to a face mask. But otherwise, where there is not that circumstance, everyone is expected to be wearing a face mask. We're talking about and expecting people to cover their cough and sneeze with their elbow. To avoid touching your face and your nose, especially your eyes, and to wash your hands with soap and water, especially when you have done any of those other things that came above that, and that you are using hand sanitizer when soap and water is not available. I'm sure we all pretty much know about the importance of washing hands, but we need to make sure that we're doing it frequently enough, especially when there are times that we come in higher contact with frequently touched surfaces and things of that nature. You want to make sure that you're doing this at the beginning or end of your day, which is going to create a habit. So if you can start that habit now, that is a good thing. Before and after any breaks that you may have, after putting on or touching anything, especially removing any face coverings, after coughing and sneezing or using any sort of tissue, before and after eating, after using the bathroom and touching trash, after touching any item or surface frequently touched by others, before and after preparing food, and that's especially important for some of the employees that work with food in our locations. The idea of hand sanitizers is a good option when the ability to wash your hands is not there. So if you do not have an option for soap and water, you can use hand sanitizers that contain at least 60% alcohol. We are also making available hand sanitizers that are not going to have smells or alcohol in them for those that may have sensitivity to those products. And while they may not be as useful, obviously, because they don't have the alcohol, they can still be used. Washing your hands obviously is the best way to get rid of germs, so wherever you can do so, you should. But hand sanitizer is also an option as well. You want to keep the hand sanitizers, though, out of reach for students that may be in your care, because there is a condition called pica, which is a disorder that would allow a child to think that any item might be consumed as food, and they would put that in their mouth. So again, the hand sanitizer having alcohol in them and also just not being healthy, please be aware of that. So we'd like you to be the example. Coughing and sneezes, they occur. We are asking people to do what they need to do to appropriately cover their mouth and nose with either a tissue, their elbow, and then to wash their hands when something like that does occur. We are in a time of year where certain allergies may be present, and not everything is COVID, as we will talk about, but there is that perception, and we just need to really get into good behavior management to make sure that when something like that does occur, that we are taking the next step to fully vet out any possibilities of germs. So the idea of social distancing, also called physical distancing, keeps coming back up, and this obviously is the space between you and other people. So whenever you are outside of your own home, we need people to really practice the idea of social or physical distancing to the extent of 6 feet or more, if possible. We will have signage up around all of the schools to remind people, because sometimes it's a little hard to understand what 6 feet really looks like. For children as well. So we will be doing our part to put things on the ground, on the floors, and on the walls to identify and also remind people about social distancing and exactly what social distancing is. Face coverings or face masks. When worn properly, they have been shown to reduce the spread of the respiratory droplets, which is actually, what is being contained by wearing that mask. Masks may prevent someone with COVID from spreading that virus to others, and that's really important because there can be asymptomatic people. But when widely used, they are seen to at least reduce the spread. They are not the only way to reduce the spread, but they are right now a requirement. And again, we're going to talk a little bit more about those that may not be able to meet that requirement, in the sense that they might wear a face shield as well. And good hygiene, social distancing, mask wearing, this really is the trifecta of all of the behaviors that we are asking people to have to minimize and or maybe even eliminate the spread. So who should wear a face mask? Right now, all adults are required to wear a face mask with covering in the buildings at all times. All students are also required to wear a face mask or covering when they are leaving the home, and that starts sometimes with the first step is getting on a bus. And if they have a certain situation that would impact their ability to wear a face mask, there is a process for that, and we are going to walk through that a little bit too. So a face covering or a mask or even a face shield are required to be worn continuously throughout the school day by, as I said, all staff and students. That would also include parents and visitors of any sort that would be walking into our building. That would also include the drop-off and or pickup time when the students are coming into the building. My suggestion is that you should bring your own mask, and that you should also bring a replacement for that mask, because you never know throughout the day something could happen. However, if you forget your mask, or if something happens and it breaks. The district will have replacement, but this is a single-use daily mask that should not be reused. A mask must be worn, as I said, on the school bus as well. So if children are leaving the building with otherwise not having that mask, they should be informed that they need to pick up something to allow them to wear that mask on the bus. You may remove your mask when, in limited times, you may remove your mask, such as eating, drinking, and if you're in a circumstance where you happen to be away from someone 6 feet or more, if you are in a room, let's say by yourself, if you are temporarily in that circumstance, or even if you are someone that works in the district and has your own office, and you have the ability to completely separate yourself from others, potentially close your door as well, then taking off your mask to allow yourself a break may be an appropriate thing to do. But what I would ask is that you make these times limited, and that you make sure you are truly in the appropriate circumstance for that mask to come off, because there is a real stigma and concern about the ability to hold people accountable to wearing their masks. And we want to make sure that we are not confusing circumstances. There are times that you can take off your mask, definitely, but they are limited, and you need to make sure that you are in the right circumstance. Should you have any questions about that, please reach out to myself or Marguerite. And it should be for a very short period of time, such as if you're having a meal or something of that nature. Who should not wear a mask? So there are a few circumstances where people are not recommended to wear a mask, and that would start with a child under the age of 2. That would also include someone that has a breathing problem of any kind, or obviously anyone that is unconscious, incapacitated, or otherwise unable to remove the mask without assistance on their own. Some people may not be wearing a mask for various different reasons, and I would just ask for a little bit of grace with people, because you may see someone without a mask and you may see a face shield and wonder why they're not wearing that mask. That face shield may be a way to accommodate any kind of disability that may impact their ability to wear that mask. If you see someone without their mask on, do not assume that they are just not complying. I would try to understand the situation. The face shield is usually a good indication, and there may be medical conditions that you're not aware of and don't have the right to be aware of, but please know that we are taking all of the procedures in place to assess the circumstances. The other time a mask may not be worn is athletes. Athletes are not required to wear a mask when they're engaged in activity or in competitions and things like that, but they are expected to wear those masks when they are on the sidelines, when they're doing something other than being involved in activity, and they need to make sure that they're also keeping 6 feet a distance. So it's important to not only wear that mask, but to wear it properly. You want to wash your hands before you put that mask on your face. Again, you're touching your face. You want to put it over your nose and your mouth and make sure it is securely fit to your face, to your chin. You want to make sure that it's snug, but not too snug where obviously you can't breathe. Anything that might be popping up on the sides or anything like that is an area for potential germs to get into your face. There is a video that we've put together identifying how to put on a mask and how to wear it appropriately. That will be on our staff resources page. Okay. Proper removal of your mask. This is something that I just referenced and is shown in our video, that there are ties behind your ear loops, that if you handle those and pull the mask off that way, it is the best way to take off your mask. It is also advisable that you're washing your mask daily, is my suggestion, because within a day, there are a lot of things that could have come in contact with your mask. And we inadvertently may move our mask, which is not advisable, but sometimes happens. So if you could wash your mask daily, have another one to switch out, would be great. Maybe a mask for all days of the week would be the way to go. I don't know, but it's just a suggestion. But we want to make sure that you are having good hygiene protocols for your mask. So I'm going to move over the computer to Marguerite, where she is sitting, socially distancing, and we'll talk about signs and symptoms of COVID-19.
All right, so the CDC and the World Health Organization has identified some of the signs and symptoms of have COVID-19. These symptoms are constantly changing and coming up with new things and taking some of the other ones away. I think it depends on the timing. One of the first identified was a fever of 100.4 or greater. Some people that are asymptomatic and some of the children are not necessarily running a fever. The one symptom that is specific that we're seeing right now currently to COVID-19 is a new loss of taste or smell that is now being identified as just having one of those criteria or that symptom that you would probably need to get testing. There are other symptoms. I think the unusual rash is more specific to children, but common symptoms would be a new cough, some shortness of breath, difficulty breathing, nausea, vomiting, diarrhea, chills and body aches, and a sore throat. Others are headache, excessive fatigue, nasal congestion, and runny nose. I think part of this is going to be very difficult in the school setting is trying to identify these symptoms with other common illnesses because they are very similar, such as, a strep throat, flu. You might see some of these with the flu as well, and even allergies. So it's going to be kind of difficult to determine which is the cause of those symptoms. So we're going to be using some of the physicians' services quite frequently this year. Who and when to isolate. Isolation is used to separate people infected with a virus, those who have symptoms, those with COVID, those with asymptomatic, meaning no symptoms, from others who are not infected. So people who are in isolation in the home should stay away from others as much as possible in the house. Try to have your own sick room and possibly use your own separate bathroom. People who should isolate are those who have been diagnosed with COVID-19, people who have symptoms of COVID-19 and are able to recover at home, and people who have no symptoms or asymptomatic but have tested positive. Those are the ones that should isolate. Quarantine. Quarantine is used to keep someone who might have been exposed to COVID-19 away from others. Quarantine is going to help separate those that have the disease that can occur before a person knows they are sick or they are infected with a virus that does not necessarily feel symptoms. Again, people in quarantine should stay home and separate themselves from others within the household. They are asked to monitor for their symptoms and any fever and follow directions from the health department. Most people that have a positive test are going to receive a phone call from the Montgomery County Office of Public Health, and they would get the contact tracers involved and identify who your close contacts are. Anyone who has been in close contact with someone with COVID-19 should quarantine. This includes people who have previously tested positive for COVID-19 and now have positive antibodies. They still would be required to quarantine. And anyone who has traveled recently outside international travel or even outside of Pennsylvania and the area they travel to is on the state travel advisory list, they will be asked to quarantine for 14 days. That is the normal quarantine period. The student attendance for virtual and hybrid model is still required for students to check in each day, whatever model they're in, whether it's remote or hybrid, that they're still required to report their attendance. See building level protocols for the attendance reporting. I think that each building may have a little bit of a difference in their attendance reporting procedures. We are requiring accurate attendance for students participating in building learning, which will be crucial for security purposes as well. Procedures for student attendance in buildings will be outlined by the building administration. So you might have the principal sharing that type of procedure with you at one of their faculty meetings. When to stay home, when to return to work. So basically, the health department has provided us with guidance of when to stay home, or even when we're going to send a student or a staff member home sick. They've used two groups. Group A requires you to have one symptom, and Group B is 2 or more symptoms, and you would need to stay home, or we would send you home from school. In Group A, the symptoms of cough, shortness of breath, difficulty breathing, and the new loss of taste or smell are listed here. So if you have one symptom from this category, please stay home. If you have 2 or more symptoms from Group B, such as fever, chills, rigors, which is shaking, myalgia, muscle aches, headache, sore throat, nausea or vomiting, diarrhea, fatigue, congestion, or runny nose, either a fever, say, or a headache, or a fever and a sore throat, stay home. You meet the criteria outlined by the Montgomery County Office of Public Health to stay home. So if you're staying home and you want to feel that you're okay to return, we would ask that you contact the school nurse at any time, during your illness, especially if you're going to be tested for COVID-19. That's something that we would want to know about. We would not want to know if you've had contact with someone who has tested positive for COVID-19, whether you've been directed to isolate or quarantine either by your physician or from the Department of Health, and also the timeline for your isolation and quarantine. So don't hesitate to contact us if you have any questions of when to stay home and when to return, because that's something we're going to be assisting the health department with, is identifying cases within the building and also any close contacts to that person that's been identified as having COVID within the building.
Okay, so we all returned to a work environment that is this post-COVID environment after the summer. And the Hatboro-Horsham School District had implemented a health and safety protocol, and that information is out there, as I said before. And these are additional guidelines that were sent forth by the county and the state that we have incorporated into a return to work that we've asked. It's called an affidavit. It is not really that legal of a term, but really we wanted people to understand that these are behaviors that we're asking everybody to abide by based on the health and safety that we will practice, and that there would be preventative behaviors that we would all be a part of and could get behind to make sure that the school environment, with whatever reopening phase we would be in, would be safe for those that are here. So every employee and staff will be required to take their temperature and complete a daily health screening tool prior to coming to school, coming to the building each day that you are due to the building. If you're not due to the building and you're not coming in and you're working virtually, you would not fill this form out. This also includes that you will be reporting, as Marguerite just talked about, any symptoms, any testing, any close contacts of a COVID-19 case, potential or confirmed, any travel that would be outside of the state of Pennsylvania, and that you could be subject to a 14-day quarantine if you have been at a state that has been put on a travel advisory list. So this affidavit should have been signed by all employees that are returning to work, and that they should also be aware of their responsibility for this daily screening tool should they be coming to the building. And that is going to be a process that we will keep in place throughout this COVID-19 pandemic. So signing in and out, all employees and staff will be required to sign in when they arrive at their building. There are added safety measures we've put in place which allow us to know who is physically present in the building. This is not only if an emergency would occur, but for the case of contact tracing. It's always been important to know who is in the building, but now we have an added layer of responsibility. Should we have a case and we need to know who was where, this is where signing in and out will become most important. So this will occur in the front offices at all of the elementary buildings. However, at the middle and high school, there will be an additional area outside of the main office that will be designated for staff coming in a rear entrance, since these are bigger buildings. Any employee or staff member leaving the building during the day should be required and should be signing out and then signing back in when they return. You do not need to sign out at the end of the day, as there's a natural understanding that throughout the end of the day, people will just be leaving the building. If you rotate between buildings, you will need to sign in and out at that new building. You do not need to do the health and screening tool more than once. You come in the morning, your first location is completed, and then if you were a traveling teacher or somebody going in between buildings, unless your symptoms change and there's a reason to go back into that form or check with the nurse, you do not have to refill that out again. So there's a certain expectation that we monitor for COVID-19 symptoms. This is not to say that we're all going to be all of a sudden healthcare professionals, but as Marguerite has talked about, there are certain symptoms that we need to all be aware of. So should staff have those symptoms as they come in and do the screening tool, they will need to monitor themselves and report that accurately. To not report those symptoms accurately would be problematic for not only yourself, but putting others at risk. So we are asking everyone to monitor themselves. And then the families are being asked to also monitor at home daily for symptoms. They will be getting weekly emails to remind them of what they're looking for and what the protocols are, and that they should be doing this before that child steps into a van or a bus or a school. And they are also asked to keep that child home if they are ill. Staff further will be encouraged to stay home as well if their symptoms are not where they need to be safe around others. I would encourage you, as Marguerite has said, to call the nurse at your building and to talk through any questionable circumstances. So although monitoring symptoms is an important part of prevention, be aware of the shortfalls of symptom monitoring in the sense that children are less likely to show those symptoms perhaps and be asymptomatic or display very mild symptoms. So even our best attempts may not necessarily get everything that is to be seen. However, if symptoms are detected, it only means there's a current illness, not that there is actually COVID-19. So I don't want everybody to get concerned if they do see something. It's more like if you see something, say something and let's further assess instead of making a determination that because of this, we now have a COVID case. That may not be the case. And again, all students and staff are encouraged to stay home when they are not well. I know that some have been concerned about using a sick day or whatever the case may be. At this point, we would rather you be safe than sorry. So the valid use of sick time is not going to be questioned if there is actually a symptom present. So as you can see from this list here, there are symptoms of COVID-19, and we've talked about them already, and you see them on the left-hand side. But you can also see how those symptoms have been attributed to, and rightfully so, certain other ailments such as strep throat, the common cold, or even the flu or asthma, all the way through seasonal allergies. So the point here is that everything has to be vetted through common sense and not necessarily reacted to in the sense of it being a COVID situation. So please keep that in mind. Use your gut is usually a good indicator of right and wrong and what you should do, and use those guidelines that are posted out on our district page to further assess circumstances and also to work with your nursing department to further assess as well.
There are some high-risk students and staff, other individuals that the CDC and the Department of Health have identified. These are individuals that are at risk for complications due to COVID-19. So every student with a disability is entitled to a free and appropriate public education or accommodation based on their IEP or their 504 plan. Some of these individuals with, say, a disability or a medical condition may not be able to maintain social distancing guidelines, or they may not be able to wear a mask. So if it's determined that the student has the inability to meet these criteria that we have set forth, then additional safety measures will be needed to be incorporated by the school district. So what we have planned is that the school nurse will inform the teacher of those students that are identified as high risk or medically fragile that are in their classroom. And in turn, the classroom teacher will inform the school nurse of those students that just cannot socially distance, or this one's not wearing a mask in the classroom. So the school nurse will have an additional screening done midday. So the student parent is usually completing the one in the morning. And then in addition to that, we will be doing an extra one as a precaution for these high-risk students during midday. So we would either come to the class or you would come to us. We would do a brief visual assessment on the student and we would take their temperature. And then we would also do this to the staff members that are in that classroom as well. This is an added safety feature for these high-risk students, hoping to catch some kind of illness between the student or the staff so we can treat it early. During the COVID-19 pandemic, school nurses are asking for your assistance in order to decrease the number of sick or injured students coming to the nurse's office with non-urgent complaints. So if there's something that can be handled in the classroom, we're asking if you can do that within the classroom. If you feel that it cannot be handled within the classroom, then please call the school nurse before sending any student to the nurse's office. We want to prevent the mixing of healthy students with sick students and minimize the number of students in the nurse's office at any one time. We're going to ask that you, once you tell us the student is sick, we're going to ask you, what are you seeing? And then we're going to ask that you have the student pack their belongings and any electronics before sending them to the nurse's office. We also would look into the nurse's office itself. We have many students that come in on a daily basis for things. They're still healthy, but they may come in for diabetic checks, they may come in for medications, and we don't want to mix those students with ill students as best we can. Certainly, if you have any questions regarding what needs to be handled in the classroom or what needs to be handled in the nurse's office, please call us. We want to see anybody that has symptoms of COVID-19. We did describe those symptoms to you earlier, and those are the students that we definitely want to see. Obviously, we had gone over students that come down for daily medications, certain treatments and diabetic care, anybody that obviously requires CPR or choking, anybody with difficulty breathing, shortness of breath, anybody having an asthma problem, anyone with a fall or a neck injury, we would want to see as well. And also anyone with altered level of consciousness that's confused or fainting is a definite nurse office visit. And in that situation, if it's, they're feeling a little bit weak or whatever, you might want to send them to the nurse's office with a buddy or accompany them yourself, or you may have to call the nurse's office and say they're already, lying on the ground, and that way we would come up to them. Anybody with traumatic injury, severe bleeding, anyone with a eye injury, and anyone with anaphylaxis, we definitely want to see in the nurse's office. And these are other nurse office visits that would be required, but really we want to see anybody specifically that has an action plan in a nurse's office. Those students with asthma, diabetes, anaphylaxis, seizures, sickle cell, or migraines are ones that definitely need to come to the nurse's office. And again, some of these students may need a buddy in order to be escorted safely to the nurse's office. If you have any questions or if you have any doubts about who should come, when, and if who needs a buddy, then certainly give us a call. Some of the complaints that can be handled within the classroom are listed here, and they may include like a minor toothache or a loose tooth, some abrasions, cuticles, blisters, bug bites, itchy eyes, and students with readily controlled nosebleeds that can self-administer pressure, and students that have some kind of anxiety or stress issues. You could try calming and reassuring, but a lot of times they do need guidance counselor intervention. And I have listed some of the treatments here that can be done in the classroom. And there are other issues here. Incontinence issues, they usually have an extra set of clothing in their school bag. Chapped lips, we are including first aid kits in each classroom. And we are including some of the Vaseline in there as well, so you can have that for the chapped lips. And we are going to be handing these first aid kits out to all the classroom teachers and special area teachers, etc. There are different types of infection control measures that we'll be using in school and different types of personal protective equipment, or PPE. There's two types of infection control measures that we're going to talk about. The first one is standard precautions, and the second one is community-based transmission precautions or contact precautions. Standard precautions are a set of infection control practices used to prevent transmission of diseases that can be acquired by contact with blood and bodily fluids. These include hand hygiene with soap and water, use of PPE, depending on the anticipated exposure, and the spraying or the splashing of the blood or bodily fluids may require a gown. You're already wearing the mask, you would probably need additional gloves. It also involves some other common practices such as respiratory hygiene and cough etiquette, and safe handling of potentially contaminated equipment or surfaces. The second one I talked about is contact precautions. This is used when a person has a type of a bacteria or a virus on the skin or in a sore, an open area, or in the intestine itself that can be transmitted to somebody else if they touch the infected individual or the contaminated surfaces or equipment from the infected individual. And this usually has to do with stool incontinence such as diarrhea, draining wounds, and ostomy bags. Contact precautions would include obviously the hand hygiene with soap and water before touching anything, and applying gloves if you're going to touch any of the person or their belongings, and wearing a gown if there is substantial diarrhea. And again, washing your hands with soap and water after removing your PPE. PPE basically refers to wearable equipment that is designed to protect individuals from exposure to or contact with infectious agents. PPE is appropriate for various types of interactions with individuals and effectively covers personal clothing and skin likely to be soiled with blood and other bodily fluids. In school, all staff are required to wear a mask, face masks, continuously throughout the school day. If a student cannot wear a face mask for a medical condition or a disability, we're going to try having the student wear a face shield. If the student cannot wear a face shield or a face mask, then it's recommended that the staff member taking care of the student or any other in the classroom wear both a face mask and a face shield for their own protection. Wearing full PPE, such as gowns and gloves, throughout the school day is not recommended in a school setting unless there's a situation where the staff member may come in close contact with the spraying of blood and bodily fluids. So everything is on a case-by-case basis, and it depends on the situation that you find yourself in. So in some of those, you may need the gown, the gloves, and goggles, or a face shield. When you put on or don your PPE, you're going to gather all the PPE equipment that you anticipate that you would need. You're going to decide whether you need the goggles or a face shield. Gather the PPE, wash your hands with soap and water. Is absolutely the best is the soap and water. If it's not available, then use the hand sanitizer. You're going to put on your disposable glove first, if that's what the case or the scenario indicates. And then you're going to put on the mask if you're not wearing one already. You're going to put on your goggles or face shield, and then put on the disposable gloves. Then when you're removing or doffing the PPE, you're going to remove your gloves first. You're going to immediately discard it in a trash can. Take off your goggles or face shield. Remove the gown. Remove and change your mask if it's needed, if it's heavily soiled. You're going to wash your hands with soap and water after taking off all your PPE. Or you can use the hand sanitizer, as we mentioned earlier.
So we're coming to the end of our resources here, and we have listed a number of resources that are available to you and which we have consulted for many different points in this slideshow, and we would ask that if you are interested to go ahead and check out some of these as well. There are a number of different trainings that either we have also created in district here or that we have received through various different ways and have made available on our district training page. We want to close by letting you know that it is our goal to keep each and every one of our employees, our students, anyone that is in our buildings healthy and safe. And to do that means the cooperation of everybody to those standards and those expectations, from wearing a mask and complying with that mask order to filling out the daily screening tool accurately based on symptoms and monitoring yourself and potentially others to bring to their attention anything that may escape them at that point for the safety of our community. So thank you for watching today, and should you have any questions, thoughts, or concerns, feel free to reach out to Marguerite or myself, and we'd be happy to help you. Stay safe.